Hello, my name is Kathleen. I'm going to be doing my Windshield presentation on Redlands versus Rialto. So the demographics of Rialto, there are estimated 80,000 people who live in Rialto. The median age of the population is 28. The population under 19 is 35%. The median housing income is 45,900. 22.5% of the Rialto population live below the poverty level. City of Redlands, the population is 68,747. The median age of the population is older at 35.9. 29% of the population is 19% or younger. The population is much more equal across the different age groups. However, there's a larger population of older adults. The median household income is 65,000. 212, and only 14.3% live below the poverty line. So the borders, Rialto borders Colton, Fontana, San Bernardino, and Bloomington. Redlands borders both Loma Linda and Yucaipa, as well as Highland. So these are both pictures right after I got off the freeway. They're both empty lots. This one was next to a Walmart. There's kind of a lot of trash in it in Rialto. Rialto is designated as the left, and Redlands is the right. They both don't really look abandoned, but there was more trash in the one in Rialto. These are the houses. So Redlands, automatically you can tell that there's very nice houses, very large houses. They're very secluded as well. Rialto has houses. There's chip paint. There's water damage on the houses. The lawns are not very well manicured on some of the houses, but there are some nice houses kind of mixed in between. They're a little bit more humble, I guess. So this is signs of decay. Oh, back to this one. Rialto has more mobile home parks that are kind of in disarray. Redlands has a couple, but they're very nice. Redlands has also apartments and multifamily dwellings, a lot of them. So signs of decay. I didn't really see a lot in Redlands, but Redlands does have a few open lots that are kind of just the yellow grass is growing. Rialto has a couple of trash I found with a tire, and then also the fence here is actually kicked in. So the people, Redlands has a lot of people that were just like out in the street talking to their neighbors. It looked like I only saw really white people, and then in Rialto I saw people walking, but it wasn't really for exercise or anything. I saw predominantly Hispanic, Black, and Middle Eastern people. The health behaviors. So Redlands, I saw a lot of people walking. They also have designated bike lanes all throughout the city. There's a lot more people getting exercise. It appears there's people that run. Rialto, I didn't really see a lot of that. People, it appeared to look like they're walking from the stores to their houses rather than for exercise. Rialto, however, has a farmer's market every Wednesday where they also accept food stamps. So that it provides fresh fruit to a lot of the population that may not be able to afford food. Risk behaviors. Rialto has more liquor stores. I passed at least 4 of them throughout my whole thing, and I'm sure there's a lot more. Didn't really see any smoking in Redlands. I saw a couple people smoking in Rialto, however. So services, parks and recreation, open spaces. Rialto has 9 parks. Rialto has a community theater and a fitness center. Redlands has 14 parks, a nature sanctuary. Redlands also has walking trails, bike lanes throughout the city, and Redlands has a country club that has a golf course, and then it does have a community center and both have senior centers. Transportation. So Rialto has an extensive bus line. It goes throughout the whole city. You can get pretty much anywhere with the bus lines, including outside of the city, all the way to like 15 miles away in Ontario. And then you can actually take a bus from Rialto to Redlands. It'll take a very long time, but you can. Redlands, they're both part of San Bernardino County, and they both have the bus system. However, the bus system doesn't run throughout the entire Redlands town. Only part of it, and there's only actually three bus routes that run through Redlands, and they all kind of go to the same area. Rialto has a Metrolink that connects Rialto to San Bernardino as well as all the way to LA. It appears that there's a lot of bikers in Redlands. I think both cities, a lot of people use their cars to get around. So, health and social services. Rialto doesn't have a designated hospital. There's a major hospital in the next city over, but there's a lot of clinics and different doctors' offices, urgent cares in Rialto. Redlands has a designated community hospital. It also has a stroke center, has a spine joint institute, a lot of um, maternity ward. Redlands also has a couple of facilities for older adults, including skilled nursing facilities, dementia care facilities, local clinics and doctors' offices as well, which is different than Rialto. Rialto, I think, has one post-acute center, and it has a senior center, but other than that, it doesn't have anything else. Protective services, there are two police stations in Redlands. This is one of them. Rialto has only one. Both have four fire stations, but the one in Rialto or Redlands looked a lot nicer. And when I drove by, I didn't even know it was a fire station. And I only saw like the trucks outside of the fire station. So churches, Redlands has over 21 places of worship. They also have a Jewish temple, an Islamic mosque, and a variety of different Christian churches, including Catholic, Seventh-day Adventist, Baptist. Rialto has quite a few. I know they have a Catholic church and a bunch of Christian-based churches, including Seventh-day Adventist as well, and Baptist, and non-denominational. So stores and shop both have a downtown area. However, the Redlands on the right, you can see that there's a lot more people there. It's actually always busy during the day and during at night. It has a very lively night scene. Rialto has a new shopping center with a new Walmart as its anchor, and it has a bunch of different smaller shops and food places. It also has three Stater Brothers, Walmart Neighborhood Store, El Super, Cardenas, and Superior, which are both kind of Hispanic stores, grocery stores. Redlands at the downtown center, it has a lot of specialty shops and a lot of independent businesses, small businesses. Rialto has a downtown center as well, but it's not as bustling. There's a lot of open um, open shops that don't have anything in them, and they're being sold and rented. Um, there's not a lot of people can't really make it in downtown Rialto. There's just not enough business. So these are health issues that I got from each of my stakeholders. In Rialto, Amanda let me know about her patient population, has diabetes, hypertension, COPD, and obesity. Redlands, I got this from Gail. She told me dementia, chronic pneumonia, stroke, and diabetes are really big issues. They also have some issues with COPD and CHF as well. So my stakeholders in Redlands. Gail's a stroke coordinator at Redlands Community Hospital. stated through a community needs assessment done by the hospital and identified a vulnerable population that includes elderly and the underinsured and the working poor. Although Redlands is a more affluent community, Gail identified areas of unmet health needs, including healthcare access, availability, and cost for the elderly, uninsured, and underinsured and working poor. Marianne, a nurse case manager at Redlands Community Hospital, stated that we need to have more public education and expand the already existing community case manager program to help prevent hospital readmissions. She states that at Redlands Community Hospital, there has been an insignificant increase in the readmission rates for patients with COP and CHF. Marianne, she said that there's already a community case manager, but it's only available to some people with some insurances. And she thinks it would be a good idea to have a case manager for everybody. So the Rialto stakeholders, Amanda, she's an RN that works in one of the clinics in Rialto. She states that there are many unmet needs in the Rialto population, especially with regards to the Hispanic population. She states that over the years, she's noticed a drastic increase of Spanish-speaking only patients. Language barrier creates care and knowledge gaps between the patient and healthcare profession. Many times, these patients end up being readmitted because they're unable to manage their own care. Glory, events coordinator at a local church in Rialto. She states that she knows a lot of people attend the church who can barely even afford to put food on the table. These churchgoers have difficulty managing their chronic diseases. She herself suffers from diabetes and states that there is not enough education within the community. People don't understand what they should eat or they can't afford to care. The church does what it can and provides a food bank, but it only operates 2 times a month, and the church also provides a senior breakfast once a month. I'll be working with Glory to kind of provide more education to the community. So these are just members that kind of ask how do they like living in Rialto versus Redlands. Monica, I don't really like to go out at night unless I'm in a car. My parents don't really let me see. She's really really don't let me. Stella, the city is improving with all the new developments, but I still don't feel as comfortable as I used to. I lived here for 50 years, and only within the past 10 years have I had my house broken into. So Chris, 70, I love living in Redlands. There's a great community of senior citizens that have provided support. I had a stroke 5 years ago. I would not have made it through without their support and great people at Redlands Community Hospital. Cynthia stated that she enjoyed the community because it's active. She feels like it encouraged her to be more active because there's always someone running or biking nearby her apartment. So just the community in Redlands, you can tell that it's different and it's more supportive, it feels like. So my reflections, there's different strengths to both communities. I feel like Redlands has a little bit more active population, a healthier population, whereas Rialto, it has, I think it has a lot of resources, but they're just not being delivered to the population that needs them. Um, and then Redlands has the hospital in the city that kind of provides outside of hospital community education. I know with Gail, she provides stroke education for people that have had strokes and stroke prevention for older adults in the community. Um, Rialto, however, I think that there's like a slightly more unsafe atmosphere. I've lived here my whole life in Rialto, but and I've never really had any issues, but I've known people that have had their houses broken into. I've had people who've gotten their car stolen. Um, I wouldn't walk around at night, but at the same time, I mean, I've never really had any issues. There's just different parts of Rialto that are not good or not nice. But yeah, I mean, I would love to live in Redlands. This is a picture of like the view from Redlands, and it was beautiful. So, other than that, that's my presentation. These are my references. Okay, thank you.